Well, welcome everyone to the 27th Degree with Chris and Nancy from 27 Degrees Consulting. Today we're really excited to have Dr. Lakshman with us. And Dr. Lakshman is an expert in men's health. So we're going to talk about all topics related to men's health today. And I know Nancy's particularly interested in this topic.
I am. I want answers.
You got it, Nancy.
So before we get going, though, I do want to recognize our sponsor. We're very appreciative of Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoastbank.com or call 508-678-7641 to learn more. So now, without further ado, Nancy, why don't you just start off?
So let's start with you, Dr. Lakshman.
Sure.
Just tell us a little bit about yourself and why the interest in this particular field.
Absolutely. So first of all, thank you, Chris and Nancy, for having me here. It's just
You're welcome. We're really excited.
It's an honor to just hang out, in this sort of format and also talk about men's health, which I'm really passionate about.
Yeah.
So a little bit about myself. I'm an endocrinologist by profession, and I trained at Boston University Medical Center, that's where I did my endocrine training. Prior to that, my internal medicine training in University of Texas in Galveston, and my medical schooling back in India, which is my home. And I've been at Prima Medical Center for close to 11 years now.
Wow, that long.
Yes, that's right. Yeah, 11 years this July. And men's health was a very early interest of mine, and I have to give credit to my mentors during my internal medicine training, as well as my endocrinology fellowship training, who had a very strong influence on me. And I think when you love the teacher, you end up loving what they're passionate about.
Yeah.
So I think that's how I got into this field. And I think very early on, I realized how gratifying it is to treat men's health issues, especially sexual health issues, which I focus on because, I get to help out two people, just not one, the person and his partner. And when you hear that from
really
them
good
and
point.
their partners, it's really gratifying. So, and that has never gotten old to this day, so which is why, I always, when I do my consults, I welcome men to bring their partners in as well. So that
that's
it's a
nice.
it's like a group
Yeah.
effort. It's a
Great.
treatment where everybody knows what's going on.
Interesting.
So I do encourage that when we see new consults in our office, our staff always tell them that it's encouraged that you bring your partner in, and not just up to the waiting room, but into the office, when I'm actually talking to them. So that passion grew throughout training. So when I finished my training in Boston University and came over to Prima Care, that was going to be a big piece of my practice that I wanted to bring along. And, thanks to the abundant support that I've received from Prima Care from the minute I walked in, I've been able to establish my men's health clinic here. And it's grown over the last many years. And I'm really, really happy looking back at the accomplishments we've made. And not only in terms of treatment options, but in terms of just the philosophy that I promote in the office, which are, cutting edge, very state of the art. And you don't really need to go to a big city to get good care.
No, very true.
Which is just one of the things that struck me when I came into Fall River, where a lot of patients were going to Boston or the big city or the tertiary care center to get care, which could be provided here locally. So that was one of my goals when I came in, to make things local so people just felt comfortable just walking down the street or driving up the street to their doctor's office and not having to deal with the anxiety of going to a big city.
Sure.
That's so huge.
That's great.
Yeah.
Under the umbrella of men's health, there's a lot. So what are
Yes.
the most popular things that you see and you treat?
Absolutely. So I think the popular things that I see in my men's health clinic, the people that walk in the door are specifically seeking help for two major categories, testosterone deficiency and issues related to that, or erectile dysfunction as a primary factor. But the two are very interrelated as well. And I'm an endocrinologist as well, as I mentioned, so I do deal with a lot of issues related to metabolic syndrome, weight gain, and diabetes particularly. And there is such a tight overlap between diabetes, low testosterone, and erectile dysfunction. So those three would be the top issues that I
Sure.
see men for, and I treat because they are very closely intertwined.
Let's dive into the erectile dysfunction
Sure.
to
Yes.
start our conversation.
Yes.
So the patients that you see, are you seeing them on referral, or can they just call you directly and say,
Yeah,
you know,
they can call us directly and request a referral, or they can go up to their primary care doctors and ask for a referral. Both are common pathways into my clinic, yes.
what's the operating definition for erectile dysfunction? And
So-
when does someone feel like it's time to go see a doctor?
Yeah, so the operating definition of erectile dysfunction basically is inability to achieve a strong erection and or the inability to hold the erection.
Right.
And most of the men that come in to see me have combinations of both. And in lay terms, the way I explain it to my patients is that erectile dysfunction is kind of like a heart attack of the penis, if you want to put it that
Yeah.
way. Because you get chest pain when you don't have enough blood flow into the heart, so you get that manifestation. And ED is very similar to that. There's not enough blood flow, there's not enough oxygen flowing into the penile tissues, so that's so it's a heart attack of the penis, in other words. So,
yeah, in fact,
Yeah.
from a primary care perspective, when we see someone who has erectile dysfunction, we often worry about those other issues. Do they have vascular disease, peripheral vascular disease? Do they have coronary artery disease, carotid disease? So,
Absolutely.
are they at risk for stroke? All of that. So,
I think that's a great point that you raised, and that's again what I share with my patients too. So I think erectile dysfunction is a little window into a man's health.
Right, right.
When
Oh, that's
there-
a great way of
When
saying
you have that manifestation, there's a lot going on in the background which you need to investigate. So blood flow related issues tend to be the bigger reason for erectile dysfunction, as opposed to, I think, the common assumption that it's all testosterone deficiency and they need to be on testosterone. So
Right,
I like to dispel that myth that I have this opportunity, that there are a lot of blood flow related issues that are causing the erectile dysfunction.
So, what are the main causes of erectile dysfunction? I mean, when does age start playing into it? When I was doing my research, I saw some stats that 40% of 40-year-olds have a problem, or 70% of 70-year-olds, and it was like I had no idea it was so common.
You're spot on. So I'll answer the first part of your question, which are the common causes. I think it is important to not downplay two things when it comes to ED, which is emotional and relational. Because those can have a tremendous impact in the ED and on a person's erectile function, and the person may not even be aware of it. So I always like to go into that first to make sure we've
Yeah.
addressed that before we go on to traditional risk factors that have some sort of a pathology. So, and especially in the wake of the pandemic
Yes.
that we have been through,
Right.
with the underlying mental health pandemic that has also sort of evolved along with it, a lot of anxiety, a lot of stress, depression related issues that have placed tremendous impact on relationships as well.
Yeah,
So
we're seeing so much of that. It's amazing. I mean, the amount of anxiety and depression,
Yes.
and now beyond that, like you say, you have that stress that's added to a relationship, and now you have two people who may have been working outside of the home and away from each other for at least 8 hours a day, and now
yes.
they're together all
Yes.
day, every
Yes.
day, and that's another stress on the relationship in many instances.
that's right. They're together all day, every day, and they're looking at the explosion of ads on social media and TV targeted to ED. It's really hard to miss. So imagine that combination.
Yeah.
It's not a very fun one. So you're just sitting there and, whoa, okay.
Yeah.
And thinking and not saying things. And
You get in the
and you're
elbow
thinking what
thing.
I'm thinking. Exactly. So I think there's been a deluge of ads targeted to men's health, erectile dysfunction, testosterone products specifically within the last 2 years. And I think people are seeing it more because they're at home in front of the screens. And that has definitely led to an explosion in two areas. One is these men's health or testosterone clinics that have popped up all over the
Right.
country.
Right.
And number two, in sales, testosterone prescription sales. So a number that I can quote that was published was, I think in 2010, the industry of revenue generated from testosterone prescriptions was like a million, it's 100 million, several millions. And now it's $1 billion industry.
Oh, wow.
So like
Unbelievable.
that many years later, it's exploded. And coming back to that other point where you mentioned about the prevalence, so you're right about that. So it was in fact studied among the cohort in Framingham, where they estimated, one of the biggest studies, where they estimated the prevalence of erectile dysfunction just in community dwelling men. And it started as early as 40, where 40% of men had erectile dysfunction, and it went up. So in other words, 50% of men in their 50s are likely to have ED, 60, 70, and so forth.
Oh,
so that's a very true fact.
So let's talk about smoking. That's a big issue. And you must counsel a lot of your patients in regards to that when you see them who are smokers.
Yes, and it comes to my surprise how much knowledge gap there is. Smokers don't realize. They know that smoking can cause heart attacks, but they don't know that smoking can cause erectile dysfunction. So that's usually like a moment when I share that with them, especially with their partners out there, it's a bigger moment.
It's really funny, and I have patients who come in and smoke, and there's less and less all the time, thank goodness. But I tell them, you're at risk for a stroke. Okay, I'll take my chances. You're at risk for a heart attack. I'll take my chances. You're going to get erectile dysfunction. I'm quitting today.
Boom. That sure had the impact.
Right.
Yes. Yeah. No, you're right about that. So I think I use that as leverage. Honestly, I do too. Did you know that? No, I did not.
Most don't.
Yeah. And I also try to add to the fact that, look, if you stop smoking today, your ED won't get worse. It's not going to reverse itself, but it's probably going to,
It won't.
Less likely. I mean, it's not a quick reversal like that, right? And your chances that you'll respond to traditional therapies are much more if you stop smoking today. Than if you continue, then you can expect that therapies will keep getting stepped up.
So lifestyle can kind of just erode at that. Yeah.
So after I deal with emotional, relational issues, and I make sure those are not the big players.
Yeah.
And if they are, I refer them to appropriate sources. But if they're not, then I address lifestyle. So smoking is huge. Alcohol, recreational drugs. With the explosion of recreational marijuana use, there's definitely sort of a correlation between the type of marijuana they use, testosterone production, erectile dysfunction as well. And then sleep is the other big thing that I address.
Yeah.
Yes. So with sleep, I would say two different sort of categories. One is sleep-related pathologies, such as sleep apnea, for instance, of which there's a very strong correlation between sleep apnea and low testosterone independently, erectile dysfunction independently. Because the men that end up having sleep apnea don't have a lot of REM sleep, and REM sleep is when a man typically, or the REM sleep is when a man typically gets his nocturnal erections. It's sort of a body is sort of testing itself, it's a little dry run, it's making sure everything is good, lubricated, well for performance when needed. So when you don't have that, that's when a man is losing his spontaneous erections at night or early in the morning. So sleep apnea is definitely a big factor there, which often goes undiagnosed. So I do bring the spotlight on that. Especially if the man is overweight or obese, it's very important for them to get worked up. And like most of the times it is with guys, they don't know they snore, or they don't know there's a lot of other issues. Again, partner input.
Right.
Do you snore? No. And then the partner is leaning back and saying, what are you thinking?
All night long.
Yeah. So I think that part is important. So that's the pathology category of sleep. And then the other category is just sleep which is disturbed because of your work routine. So shift workers, or even professionally, cops, firefighters, I mean, they do work night shifts, long shifts, stressful shifts. They don't catch up on sleep during the day, which is true, I think, with most people that work at night or third shift. They don't compensate for that during the day. And when the whole world's awake, they just sleep a bit and then go about their life. So I think there's a big sleep deficit there. So I think that can definitely have a huge impact on your ability to perform, your erections, your body's natural ability to produce testosterone. So that is huge.
So then...
Let me ask you a question. You're hogging all the questions.
Oh, go ahead then.
Let me ask you about diabetes
Yes.
too, because that's such an important topic with erectile dysfunction.
Absolutely. So I think with diabetes, what's basically happening is diabetes is sort of a metabolic syndrome that's arising out of excessive fatty tissue. So the person being overweight or obese, and sort of the fat that's located in the middle, in the mid-gut, that's leading to inflammatory responses that is then contributing to development of diabetes and sort of the friends that brings along with it, high blood pressure, high cholesterol. So all of these changes significantly impair the body's ability to make testosterone naturally.
Yep.
So that is one piece of the story. The other piece is that these are risk factors for you to develop vascular disease or disease of the blood vessels. So your blood vessels are developing plaques, they're clogging up, and as a result of which enough blood is not going to places where it needs to be. And I think it's sort of a design default when God designed men. He gave the narrowest blood vessels to the penis, farthest away from the heart and from the aorta. So those are the ones that get clogged up initially.
Sure.
Those are the narrow. They're only 2 to 3 millimeters thick. So they get clogged up very easily, which again is why erectile dysfunction is a very early sign that some sort of vascular disease or disease related to your vascular or blood vessel system is brewing. So with diabetes, besides a compromise in testosterone production and a compromise in the blood flow to the penis, there's also a component of sensitivity or nerve-related pathology, where when you have diabetes that is not well controlled, it ends up taking a toll on your nerves, the impulses they carry. So there's that added layer of men not having enough sensations in the genital area. So that also compounds the pain.
I think a lot of people know that, if you have diabetes, you can get painful neuropathy in the legs and that, but they don't think about the fact that you can also have nerve-related issues in the penis too.
Exactly.
Which is interesting.
Yes, that's exactly. So that can manifest in a number of ways. So just erectile dysfunction where firmness, duration is compromised. The other thing could be premature ejaculation. Men can develop that too when they have some sort of neuropathy from diabetes. And then lastly, just sensations are not there. And some of them can also have orgasmic issues where they're not able to orgasm or delayed orgasm, things like that. So many layers of sexual dysfunction from just by virtue of having diabetes.
Yeah.
When you're looking at a treatment plan, and so say someone's 40 pounds overweight and they're diabetic, you're working on that, but they may not get to their best point on that plateau. So what are the treatment options?
So I think when I approach lifestyle, which tends to be the sort of the big cost, a big factor that needs to be addressed, I try to set a weight loss goal, but that by itself is not going to sort of, fix.
Right.
I mean, I can just preach and then move on to my next patient. But what I try to tell them, and I recognize that it's a vicious cycle. So this has to be said about both testosterone and erectile dysfunction. So when a man becomes overweight, obese, and kind of accumulates abdominal fat, testosterone production drops. And when testosterone production drops, it becomes harder for the guy to get the motivation to go exercise. It
becomes a vicious cycle.
Exactly. And then that leads to more weight gain. That drops the testosterone levels further. So vicious cycle there. Yeah. Same has to be said about erectile dysfunction too. So once ED sets in, for whatever the reason might be, the frequency of a man's ability to have sex decreases. And that by itself sort of compounds the ED. So men that have sex regularly maintain their erectile dysfunction. Men that don't are twice as likely to get ED. So both issues kind of feed each other.
Okay.
So with testosterone, low testosterone and diabetes, I like to address the lifestyle and weight loss in sort of more than just counseling, but also try to see if there's medications that I can use to promote weight loss. So in the diabetes realm, we are fortunate to have a lot of medications that are now available.
It's amazing how many there are.
Promote weight loss.
Just compared to 10 years ago, what we had. It's incredible.
Yeah, and that's the shift now, right? If there's a new diabetes drug in the market, it is going to be weight loss promoting.
Yes.
Which is the key, which is the heart of the issue.
Oh, yeah.
So I like to address that. And I think what I definitely want to address is to get the testosterone levels up. So although obesity, overweight, that seems to be the root of the issue, we have to break that vicious cycle somewhere. So I think the more rewarding way to break it is to sort of boost their testosterone levels up and get it up, rather than solely relying on weight loss, which takes a while to take into effect. So that's why I like to focus on the testosterone piece and try to get it up. So then they have more motivation, they kind of feel better overall, they put in the work, and then they lose weight.
So,
Chris?
you're going to talk about testosterone replacement, but for those who are watching this, for men who are watching this who are interested, they can still do things on their own, like exercise, keep their weight down to a fairly ideal weight, eat healthy.
Focus on your sleep, that would be huge.
All that is important.
Yes. And the other box that I also always like to check off is just look at their medications.
Okay.
Are there
right, of course,
medications in there that are causing erectile dysfunction that may be modifiable, sometimes not? In that list, antidepressants, also called SSRIs, are top in that category, so they can lead to erectile dysfunction, and then it's compounding the issue. I think whatever the cause of ED might be, it eventually becomes a big emotional part as well, or psychogenic. So because when a man doesn't perform well 2, 3, 4 times, then it's weighing on him tremendously.
And that kind of, it becomes like a vicious cycle. It makes the whole thing worse because now they're thinking negatively about their sexual function.
Performance anxiety is huge. And then there is also that, I call it double guilt, because partners of men with ED are very quick to assume that they might be responsible for it. And that happens like that. And then when the guy that has ED becomes aware of that, he has guilt of that guilt. And then I think that only compounds the performance anxiety.
It's so complicated. It really is.
Yeah, so recently what I have sort of adopted in my practice is to have a health coach, not a trainer, a physical trainer that makes you exercise. So I'm in the initial stages of it, where I'm collaborating with a health coach who's she's in California, but I like her work, and I guess with the pandemic, distance is no problem.
Right.
So what I kind of use her input is to help them talk about these layers, which I often don't have the time to delve into deeply, about what the relationship has come down to, or how would you like to renew, refresh, are you single, what are the barriers that keep you from getting somebody new. And how she deals with it is she tries to find their character strengths. She has them fill a questionnaire. Everybody has unique character strengths, and use those to tackle your problem. So, so I've been using that because I feel like that the emotional part, which can be huge from the get-go, or which can become huge because of the reasons we talked about, will need separate addressing.
I'm really glad you do that because, I mean, I have a few men who, on their own, find these clinics, some are up in Boston, and not to be disparaging about what others do, but what I find is that they get huge amounts of testosterone to the point that they're super therapeutic. The level is way above what it should be normally, but they don't address any of these other issues either. It's just more, give them more testosterone than most would feel comfortable giving, and then leave it at that.
I know.
And
I agree. And to them, it becomes all about showing them that piece of the lab result where the testosterone is now in 4 digits, and you're fixed, go. It's a very number-oriented treatment strategy.
It is, So maybe we can talk about testosterone replacement.
Sure.
Let's get into that.
Absolutely,
Well,
yes.
wait, hold on.
Oh, wait.
I had one more closing
go ahead,
question.
Nancy.
Just to go through the treatment. So everyone's heard of Viagra
of
and
course.
Cialis and everything else. What else do you do?
Okay. So, yes, the basically, we'd like the treatment to be as non-invasive as possible. And preferably, if it can be, if lifestyle modifications can do that for the person, he's thrilled. But then often that may not be enough. You need a little buddy to help you out initially, a little help to boost your confidence, because confidence has been shattered, it's deflated. So that's why you need various things. So there are certain natural supplements that can be given to address erectile dysfunction. Because before I get into any treatment, I always like to sort of get input into what the values of the patient are. Like, what are you thinking? Like, do you want to go straight up to medications, or are you thinking, I'm more of a natural supplement kind of person?
That's great.
So I like to use that input, look at the symptom burden, look at their values, and then come up with a plan. So there are some natural supplements that can help. For more immediate results, you need that family of what is also called PDE5 inhibitors, which are Viagra, Cialis, Levitra, to name a few. Now we have compounding pharmacies that make these medications in the generic versions that are more affordable. So for people out there that are listening where Viagra, Cialis, etc. have been prohibitively expensive, know that there is a cheaper option. You can ask your physician or come to our clinic where we're able to make it available at a more affordable cost.
Right.
Where it just it's all done remote over the phone. You pay, it gets shipped over to you.
Oh, nice.
So you don't even have to
Yeah,
go
it's
to the
easy.
pharmacy and sort of eliminate that step
that
of it,
conversation.
right? Like, and have that conversation.
Yeah.
That started a whole market because
It
men are
is.
afraid to have those conversations.
Exactly.
So you hear these ads for
Yes.
Roman.com and all these different companies,
Huge.
and it's all, a lot of it is because
Yeah.
we're afraid to talk about it.
You are absolutely right, and they want to keep it as discreet as they can,
Right.
and just do it really quickly. But I some of those platforms, one has to be careful because a lot of the responses are very automated. There are robots that are
Right.
just going, "Do you have erectile dysfunction?" Yes, no, 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 no. So you don't have that personal
Right.
human
It's just a
connection. So I
one-dimensional
would just put a
algorithm.
little.
Yeah.
Oh yeah, I would never
vertic-
recommend it, but I just
Caution.
find it fascinating. The
You're
whole
right.
industry has built up around
And they've become
men's fears to discuss
and they've
the
become
issue.
so openly, easily available.
Right,
So during the pandemic last year, when we transitioned into virtual completely, and when I was doing men's health consults over the phone, I would just find guys that would just get their calls from the car or somewhere where
Right.
they would just want to talk their hearts out,
Yeah.
So I find myself being sort of a mental health professional 50% of the
Right.
time.
Yeah, it's a lot.
But yeah, so those have definitely blossomed.
Yeah.
Yes. I lost my train of thought.
So the treatments. So we
Yes.
talked about the medications.
So these are medications. So these are available in the generic formats, and they can be taken on demand as needed, a couple of hours before anticipated sexual activity, or they can even be taken on a daily basis for men that would like sex to be more spontaneous and not have to think about or
Right.
plan. There is that daily treatment option as well.
Okay, great.
And then when that is not effective enough, now we're slowly escalating therapy. So now we have devices such as a vacuum-assisted device or a penile pump, which basically uses the principle of vacuum, a negative air suction, to draw blood into the penis. A lot of guys find that distasteful, just the fact that you have to add a device and get it.
Right.
But again, I'm surprised with the other 50% that let's do it. I just want to use it, and that's fine. And that's because their philosophy is not to take medications.
Right.
That's the value that
Nice.
they want to be vocal about. So that's there. And then the next step would be gels that can be inserted into the penis, and that can bring about an erection. And again, it's highly dependent on patient preference. Some guys like the idea of it, some don't. And then when that doesn't work, and again, you also have to think about things that don't work, right? Pills, a guy might be okay with pills, might be okay with pumps, might be okay with gels, but it's not working. And that often goes to show the extent of the blood flow compromise that they already have. When max doses of pills don't work, I'm already telling them and I'm preparing them, listen, this is going to be a bit of a journey, because
Right.
that's telling me that, you don't have enough
Right.
open or patent pipes to bring blood there.
Right.
So then we are stepping up to the next treatment modality, which is injectable therapy. And as distasteful as that sounds, it works great, where you're bypassing all the vessels that take chemicals into the tissues of the penis, and you're just injecting the chemical externally right into there. And it's called Trimix Therapy, popularly known as Trimix Therapy, because it's a combination of 3 different sort of naturally occurring chemicals that you synthesize in a compounding pharmacy, and you're just basically injecting it in there.
And so are you injecting that, or is
I'm
it?
not. I trained them. I show them how
Okay.
to do it in the office. We
Okay.
do that over several sessions so that one becomes comfortable about doing it.
You'd have to be on call a lot, you know.
Yeah.
Saturday night, can you come down and
Well,
give
I
me an
didn't
injection?
know if it was like an injection. Wait a minute, guys. I didn't know if it was an injection that you just gave in the office and it lasted like a month.
I know,
or if it's
right?
like,
Yeah, so we have to time. Most of the guys tell me that when I give them the shot, can I leave? Like, no, not yet. So that's my policy. My disclaimer is you will leave the way you came in. Like it's a liability. I cannot let you go out like that. And that's important. On that note, humor is such a big part of you know my strategy of dealing with these guys because you have to. I mean,
Yeah.
I turn it into more of a locker room side of talk format. You know, we're just friends. We're just talking. You know,
Yeah.
I want to take my medical hat off and just feel free because when have you had the spotlight to only talk about your sexual dysfunction, right?
Yeah.
It's
Right.
always other things we talk about, you know, other things that are on your face, but
Right.
this that is equally important, but you're hesitant to talk.
Men are
Also
really
Yeah.
talk about that.
Often
Right.
afraid.
But here, when they come in, I know why you're here. You know that I know why you're here. So let's go for it. You
Yeah,
know?
right,
Let's
right.
cut all the small talk. Let's go for it.
Yeah.
So then there's that injectable therapy. I find that men that do self-injections for other things such as diabetes, insulin
Yeah.
injections, they're more receptive to this type of thing.
Yeah.
So they are. That is sort of the end of the road for invasive strategies. After that, basically, we're talking about evaluating the candidate for an implant, a penile implant, a penis implant. For ones that are not familiar with this term, it's basically a silicone implant, just like you get breast implants. It's
Yeah.
made of silicone, and a urologist, a surgeon, would implant that into the soft tissues of your penis, and then you would basically use it.
Nice.
So that's sort of that pathway. There have been a lot of newer treatment strategies that are developing. One such, which is a drug-free and a non-invasive treatment strategy, is Gainswave, which I have been offering to my clinic patients for about 3 years now. So it's a drug-free, non-invasive treatment strategy, which basically uses the principle of sound waves that are applied onto the tissues of the penis. It's also called shockwave therapy, but it's basically sound waves. There's a little bullet in there that's vibrating and generates sound waves that are applied to the tissues of the penis. So they basically come in to see me for weekly sessions. At least 6 weekly sessions are recommended to have desirable effects. But for some that have significant compromise, already they may have to end up doing 12 sessions.
And what's it doing exactly? Tell our,
So-
our watchers here.
Exactly. So the analogy that I like to give is when you go work out in a gym, you're basically causing like micro tears to your muscle fibers, little micro trauma. And then when the body heals, it heals and makes the muscles bigger, better. So it's the same analogy that's applied here. So these sound waves cause small amount of micro trauma, minuscule amounts of micro trauma to the blood vessels of the penis. So then the body is alerted. It says, oh, I got, a problem there. I need to send growth factors, reparative factors, healing factors down there. Got to recruit those to that area involved. So you're tricking the body into doing that
Right.
significantly.
So is it forming collateral blood flow like other blood vessels?
It is. So
Okay.
it's forming new blood vessels. It's plumping up the existing blood vessels.
Okay.
And it is also forming new neuronal pathways.
Really?
Yeah. So you have
Well, that's interesting.
Yeah, so you have plump blood vessels that are thicker, better. You have new blood vessels, and you have more nerves. So as a result of which, you have more blood supply, you have fuller erections, you have more sensations, and that is a beautiful, sort of innovative therapy that has.
And that's
come up.
covered like under insurances and
No,
stuff.
so I was just going to say that. So that's the only tricky part. So insurances are still looking at it as a cosmetic therapy for which they don't want to reimburse.
That's unfortunate.
Yeah.
Do you find it really helps men out who?
It
who
definitely does, and everybody has something to gain from this type of therapy. Depending on where you are in the ED sort of spectrum,
Right.
everybody has something to gain from it. Yeah, and the effects of one sort of round of treatments, 6 sessions or 12 sessions, has long-lasting effects. 2 to 3 years sometimes even.
Well, that's great.
Oh, wow.
But some of those guys will need to come back for a booster.
Right.
Yeah.
And the trend now that I'm seeing is that men want to come in. You don't have to have erectile dysfunction to come to get Gainswave. If you want a little enhancement.
Sure.
Or like one of my patients said, you can always make a shiny car shinier. So, and I said, I completely agree with you, and you're in the right place.
Pretty funny.
So some of them just want a little enhancement.
Yeah.
So
Yeah.
and again, it's
And what is the cost?
So weekly sessions are about $500 per session. So your 6 sessions can cost up to $3,000.
Yeah.
And then when they want additional sessions after that, they get a volume discount. So yes, it's definitely heavy on the pocket.
Hopefully it'll be covered by insurance at some point.
I'm really hoping so. Yeah, I am hoping so. Yeah, so that I think covers pretty much all of the treatment strategies that we have.
Can I go back to the injection part?
Yes.
Because I don't offer that in my practice.
Sure.
The mechanics of where the injection is done, I'm curious.
Yeah, so basically, if this was the penis, we basically inject it in the soft tissues on either side. So it's either
Okay.
there or here. We try to avoid the top and the bottom because that's where the blood vessel bundle, the neuronal, the nervous bundle is running. And it's basically an insulin syringe that we inject.
A small needle.
Small
Yeah.
needle, and you just use up about. And again, there are different strengths of this preparation, which is called the Trimix. So I usually start with the medium strength, inject a small amount in the office, go back in 10 minutes and see how you are. And over time, I have the patients do it themselves as I'm training them, just so they get used to the
Of
idea,
course, yeah.
as opposed to just taking it and good luck,
Right.
So it has to be done very carefully because you can easily overdose, and then you end up getting what you can relate to as a TV warning that says, oh, if you have an erection for more than 4 hours, you need to go to
Right,
the ED. So
right.
that can end up happening easily if you're not careful with these injections.
Okay.
Yes.
All right, cool. So over to testosterone.
Yes, that was what I was thinking.
Absolutely. yes.
I actually want to start off with a question
Yes.
to you.
Okay.
So as a primary physician, is this part of like annual blood work? Do you normally throw testosterone in
That's a
your
good
blood
point.
work panel?
So we
You're
have
smiling over there.
We have to, so as primaries, we have to have a diagnosis for every lab test that we order, okay? Or insurance won't cover it. So we have to be very careful. A lot of times patients will come in and say, can I get a vitamin D level or get this or get that? And I have to try to think, is there a reason that this is
Right.
necessary? Because otherwise they get stuck with a bill. So it's not part of the routine. Everyone gets a testosterone level over 50. But if I have men who come in who have symptoms that suggest testosterone deficiency, if they have decreased libido, decreased muscle mass, fatigue, maybe depression, then I can make an argument to order it, and I do.
It just seems like after the conversation we've just had, it seems like it should just be part of a normal annual checkup.
Yeah, I agree with you. I see where you're coming from, but
Now he's going to tell me that I'm wrong.
No. I think it's right, and
Yeah.
it's important. I think the truth is halfway.
Yeah.
Halfway, where you have to keep the symptoms that are associated with low T in the back of your mind, and test people that have those symptoms or are at high risk for having low T based on the other disease states that I have.
That makes sense.
That they have. So the part A is the traditional association of low T is low libido, ED, or just ED, right? Which we just learned that ED is more likely from other causes than low
Right,
T.
right.
We want to know that there are a host of other symptoms that low T can also give rise to. It's just not ED. So that's important to know. So like Chris just mentioned, so fatigue is such a non-specific symptom, but
Right.
it can easily be brought about by low T. Mood-related issues, again, important. Anxiety, depression,
Absolutely.
irritability. Men with low T tend to be irritable, and countless partners have confirmed this to me. They're not fun to be around. So these things are important to know because, for instance, if a man that came in had depression purely from low T, and the knee-jerk response was to give them an antidepressant, you might end up compounding their
Right.
sexual problems and more
Right.
ED and things like that.
Right.
So those more, and a lot of men that come in with low T have talked about, or because I specifically asked them, memory issues, fogginess, just sort of that mental edge. A lot of men seem to lose that. Cognitive, so there are cognitive effects of low T as well, other than just energy, fatigue, and things like that. Loss of muscle mass, weakness, just that motivation, or just simply weight gain. So all those are important symptoms to sort of keep in the back of your mind that a guy might have, besides just from the sexual realm of things. Sleep, so men with low T can also have disturbed sleep. So that is important to keep in mind as well. So I think it's, and then the other piece would be men that are at high risk for low T, such as diabetes or obesity, anything obesity related, such as sleep apnea, diabetes, hypertension, hyperlipidemia. Important to keep in mind that they could have low T from that. And then anything related to sleep. So sleep apnea, shift workers, people that work, odd hours and things like that. That's important. I should not leave out. I would be remiss if I left out opiate use or methadone use for former opiate abusers. Those are also, that's an important category. Or patients that use pain medications in the long run.
Yeah, I see a lot of that. Patients who've been on pain meds for whatever reason, a lot of them do have low testosterone levels, decreased libido, sexual dysfunction, et cetera.
Exactly. And again, that's another vicious cycle. So low T lowers your pain threshold. So men end up needing more pain medications. More pain medications will drop your T even further. So some of the lowest T levels that I've seen in men in my clinic are those that take pain medications for whatever reason it might
What's
be.
the normal range for testosterone?
It's a wide range, 300 up to 1100. That's what the lab would report. But that's all ages sort of put together, which brings me to the point that I wanted to make, that testosterone levels do decline as men age.
Okay.
So they
All right.
do. So the highest levels of 1100 you would usually see in a teen that's going through puberty in the 20s. And then with every age decade, just by the fact that a man is aging, his T levels do drop. Then you have these other health conditions or lifestyle changes that will shift the trajectory. So that's where you get into trouble. So you're doing things or you're adapting unhealthy lifestyles, or unfortunately you have other disease conditions that just shifted that trajectory so quickly that by the age of 50, you had a T level that an 80-year-old would normally have.
So if you see someone in the office who has low testosterone and you've gone through the usual process you go through and you've come to the conclusion that they need replacement,
Yes.
what level do you like to keep them at?
So I like to keep them, again, age-related. So I like to sort of adjust them to what their T levels may have normally been at their age. So if it is a 70-year-old that's coming in, I like to keep them in the low end of the normal range. So about 400 to 500 or so.
Okay.
But again, somebody that's in their 40s or 50s, I like to keep them in the upper half, above 500. So between 5 and 8 or so.
Okay.
So in other words, I'm just doing for them what their bodies would have naturally done if they were just aging healthily, which...
So I'm sorry, go ahead. I'll ask my question after.
No, I was just going to say, so when we talked about all the testosterone clinics that are out there, if you have an inflated number on the testosterone.
This is the question I was going to ask.
I knew it. I could feel it.
Yeah, that's good. That's good. So someone has a level of 1,500 or something because they're going to a clinic.
I mean, I guess is, what happens, like your body probably has a protective mechanism that it's shutting something down with that, right?
Unfortunately, it doesn't.
It doesn't.
So the body will end up, there will be some repercussions from keeping levels too high over a long period of time.
Okay.
So some of those, the common sort of adverse effects related to that are, one, your red blood cell count that can get pretty high. Testosterone promotes synthesis of red blood cells in your bone marrow. So if you take too much, if you have too much, you can end up having a red blood cell count that's too high. So then the blood gets very thick. Thick blood can clot. So you can have issues of blood clots and things like that.
It's risk for strokes.
Yeah.
And
So kind of issues that you can almost anticipate by going against nature. There was a reason why body devised a strategy to have T levels decline as a man grew older. So when you're going against that, you will have issues. And as men get older, their metabolic clearance of testosterone also drops. So by giving them too much, you're creating that backlog. It's just sitting there. It's not being cleared by the body. One of the important mechanisms by which testosterone gets broken down by the body is to convert it into estrogen. And then the other hormone is DHT. DHT is sort of the unwanted child in an older man, because that's the one that promots baldness, male partner. DHT, the only role of DHT... I get a lot of that. The only role of DHT is when there is differentiation occurring at the embryo level. when the baby is sort of differentiating into
Yeah.
a male, that's where this hormone DHT promotes the formation of male genitalia.
Okay.
And that's about it. I don't know why the body keeps it around
Yeah.
for a man to lose
like
hair
done.
later. We don't
There
understand.
must have been some evolutionary reason we became bald. I'm sure there's some advantage.
We need to find that. I'm on the lookout for that.
I'm not sure what it is, but it's got to be out there somewhere.
Yeah, so the estrogen again is a very controversial hormone
Right.
in women and men, right?
Right.
So when you have such high levels of testosterone, it's doing some of these things. It's causing your red blood cell count to be high. What I missed is it promotes prostate growth. Also, testosterone is fertilizer to the prostate. So when older men, as such, tend to have larger prostates, which is a part of the normal aging process.
Right.
But by keeping testosterone levels too high, you can accelerate that as well. So those are the direct effects of testosterone. Estrogen can cause a slew of things as well, which our biggest concern is that estrogen modifying your blood vessels in any way, the walls of the blood vessels, is it causing plaques? Similar to the concerns when women got estrogen and hormone replacement therapy after
Right.
menopause, which is why there's big sort of hesitancy around that. So we don't know that. So some things we know, some things we don't know. The things that very high estrogen levels could do to a man, we still don't clearly understand, but there is a potential risk there.
So if I'm a guy and I'm told, hey, you have low testosterone levels, but like I'm good, I don't want to treat it, is that fine?
Great question. So yes and no. So if you don't have symptoms at all, you don't need to be just treating a number. It's okay to just watch. And I do get a lot of these type of consults, so you raised up a great point. So we don't have to treat if you're doing well overall, if you lead a relatively healthy lifestyle, and also if, as a physician, I cannot really tell why your testosterone levels are low. And we do see that falls under the bucket of unknown, low T of unknown cause. We don't know what the reason is. It's okay to watch them. However, we do have wealth of studies showing that a man with low T has has risks for a lot of things to go wrong as they go older if the T remained low. So, for instance, to name a few, men with low T, in a lot of longitudinal long-term studies, men with low T were more likely to develop diabetes. They were more likely to develop heart-related issues. In fact, there are studies correlating low T to a higher risk of mortality as well. Men with low T had a higher chance of dying later in life from complications. So low T, future risk of diabetes. Low T, cardiovascular issues. So there's a lot of data. And an interesting observation is in men that have prostate cancer, one of the treatment strategies is to intentionally get their T levels to nothing. Because testosterone is known to promote prostate cancer growth. We still don't know if it causes it, but it promotes prostate cancer. So men that have prostate cancer intentionally get their testosterone levels nullified almost. And they don't do well metabolically at all.
No, it's a really terrible thing to deal with.
Yeah.
I mean, the men I've had who have had prostate cancer have gone through hormonal therapy such as that. You know, they just feel terrible. They feel weak. They have hot flashes. They develop obesity, depression.
Yeah, the diabetes goes out of control. It spirals down. They get So then that's really a great reference point, right? When you acutely do that, that's what happens. So it's you can extrapolate that to what happens if you left a guy with low T over time. So I discussed that with these men. You know, I don't want to say. I want to start out by saying, yes, if you're feeling okay, we don't need to. But keep in mind, you know, there is a risk for you to develop such and such condition. So we should be in touch. We should still measure them, you know, periodically and see what's going on.
So what are the replacement options? What can men do to raise their testosterone?
Sure. So there's two buckets. So besides lifestyle modifications, which I always talk about, the active sort of strategies to raise their testosterone are under two categories. One is testosterone restoration, where you're naturally trying to boost your factory. And then the other piece is testosterone replacement, where you are giving them synthetic testosterone. And again, I talk about both these, and it's completely up to the guy what his preferences are. So for ways that raise your testosterone level naturally, do have you have a lot of weight that is carried by lifestyle modifications for that sort of an approach.
Okay.
So you got to be good with your exercise, your diet. You got to be exercising, because that by itself is boosting your levels. And then we are adding medications to also do that. So when you do the two together, you can be reasonably assured of getting your T levels to a good place. So some of the popular medications that are given for that, one is Clomiphene or Clomid. That's again the same infertility medication that's given to women. That's sort of where the application came from. In women, it causes them to make more eggs and ovulate more. So in men, it does the same thing. It causes them to make more testosterone naturally. So that is a very popular medication. Anastrozole is also another medication that's given to naturally try and boost your body's production. There are some natural supplements as well that
I was just going to ask,
Yeah,
is this
tell us
all
about that.
prescription?
there are
or-
no diets. There are no diets that are related other than whatever diet you can, rely on to keep you lean. That's really my blanket answer to that type of a
Right.
question. There's no one wonder food that will do that. But there are certain supplements, that may have some role, but that's unstudied, honestly. It's really unstudied. But these medications are sort of front and center. So I usually have them take these medications, and I tell them, if you want a really good shot at these medications to work, put in the work also. And then, we see them back. And if they have diabetes as well, then my focus would be on modifying their diabetes therapy to the ones that promote weight loss, so that everything comes together nicely.
Right.
And I have noticed this, and there are studies to support too, that as you raise testosterone levels in men that have diabetes, their sugars get better controlled. Because testosterone is an insulin sensitizer, and what that means is it just makes the insulin more effective that your body makes. So it's kind of like the metformin that everybody knows
Right.
about. So
Right.
that's my metformin, testosterone.
It's
You know-
amazing because I have a patient who notices this when he's off his testosterone, his diabetes becomes
There you go.
less well controlled.
Yeah.
And before I knew anything about that, I
Yeah.
thought, well, maybe there is an association, but clearly there
Yeah,
is. Yeah.
there is.
Y-
Yeah.
You know, if one thing was apparent through this whole conversation, it's that so many things are interconnected.
Yes.
You know,
Right.
it's like, I had no idea. I just thought it was a little more isolated, but it's like
No.
everything
Yeah.
falls into that bucket.
Yeah. And then that erectile dysfunction is that little red flag,
Yeah.
that's giving you a clue
Like,
that there's
hey.
a lot of things simmering.
It's
Right.
really a window into what else is going on in the
Absolutely.
body. You know,
Yes.
when you have that, it may be from a lot of different causes, but you have to pursue the cause because it can really be
Yeah.
something larger than just the erection
right.
issue. That's a medical
Yeah.
concern.
Yeah.
So if you're going to give testosterone, if you've come down to that,
Yes.
how do you do that?
So for so now we're shifting gears to synthetic testosterone replacement. A man is taking testosterone from the outside. So there's different formulations, and I think it's the market for that has really diversified a lot, keeping in mind that patient preferences can be different. So the tried, tested, trusted methodology of testosterone replacement is testosterone injections. It's been in practice for over 100 years. That was the very initial form of testosterone replacement. Testosterone cypionate is a very common compound that is injected. Those injections, traditionally, they were given every 2 weeks. That was the initial treatment protocol. But in my clinic, I've sort of adapted that to every week. You basically either inject it into your muscle, which has been the very traditional approach. But again, I have taken sort of a different strategy after reviewing some studies that just injecting it under the skin, like you would do an insulin shot or an EpiPen, that works equally good.
Nice.
Because certain men have injection phobia, and with the intramuscular, you often end up becoming dependent on somebody to give you the shot. But there are different sites you can take an intramuscular injection. It can be in the buttock, it can be in the thigh or the shoulder. I encourage men to do it themselves. That
Yeah.
again is a switch from the traditional approach where a man went to his doctor's office to get the injection. Now we like to do that differently as well, where you
Right.
just do it yourself.
Right.
Don't
Right. Makes
don't
sense.
rely on anybody, your partner or your
Yeah.
doctor.
We try to
Just do
teach
it
our patients
yourself.
the same.
Exactly. So pinch the skin in your belly and go right in. That's pretty easy. And then you do it every week. So that's a standard regimen. With any testosterone injectable, the way the body disposes it off and the way the medication works, in other words, is a roller coaster. So the levels go up and then they fall quickly. So it's a very quick up and down, which happens every week. So every week the patient takes it. The first 1 or 2 days, they're rapidly building up, and then they sort of quickly flow down. So one has to be aware of that. Some guys are very sensitive to that roller coaster sort of journey. So they feel great the first half of the week, and then they don't feel
Not
as
so
good
much
on the
the
second
last
half of the week. And patient partners have attested to that. I like being around him on Mondays, Tuesdays, and Wednesdays.
Change around my work
yeah,
schedule.
and then change my work schedule. Yeah, so that's important for them to know. So that's the injectable. So with the injectable, there are fast-acting injectables, which are these, and then there is a relatively newer, as opposed to 100 years. This is called Avid. It's an injectable that is a longer-acting, and it stays in your system for about 10 weeks.
Oh, wow.
So that's been in the market, I want to say, for about 8 years or so.
Okay.
And that has to be given at a doctor's office, though. That cannot be taken by self.
Right.
So it's a larger volume, and because it's a large volume that's injected into the muscle, that's always the buttock. So I have my patients come into the office, and we will do it there.
Okay.
And because it's a larger volume, there have been very rare case reports of tiny droplets of oil getting into your blood and into your lungs, and it can cause like a little coughing spell, fit, or shortness of breath. It's also called an oil microembolism. That's a very rare phenomenon, but the FDA requires that we watch patients in the clinic for about 30 minutes after the injection.
Okay.
To this day, like, we've given over several thousand injections. We have not,
Nothing.
and I don't really know of other colleagues, practicing colleagues in Boston, that have noticed anything. But we do our diligence, and we keep them. And 30 minutes is really not a stretch, because from the time they give the injection, so they get it right away, and then the MA is getting
Right,
their triaging, medical reconciliation, and I come and talk to them, and 30 minutes is
So
up.
it's
So
over.
it's not that
Yeah.
they're just
Yeah.
waiting there. So that is called Avid. So they come in every 10 weeks. So we have a quick injection every week that can be given every 2 weeks too, and then we have this long one that's given every 10 weeks. So that's
Okay.
the injectable family. Then you have the skin products, or transdermal, where it's either a patch that you apply every day. It's called the Androderm Patch, which is one of the first skin product of testosterone that was made more than a decade ago, which is unfortunately kind of lost its appeal.
I don't find they work as well. I mean,
Yeah.
I can't get the levels to where they
You're
need
right.
to be with the topical
Absolutely.
stuff. So
Yeah.
men who start on it, occasionally they'll be okay with it. More than not, in my experience, they end up on an injectable.
You're absolutely right, which is why I don't do the patches anymore. And again, the success of a product that you apply on the skin really depends on how well the skin absorbs it. So the testosterone patches could either not absorb too well, or the bigger problem that I have faced when I was prescribing it are skin reactions. The adhesive is an irritant, so they can be
Right.
redness, itching, and things like that. Falls out
Right,
of favor.
right,
So I don't prescribe the patch as much anymore, unless that's the only thing in the formulary of the insurance that the patient has, which sometimes governs what product. I mean, I'm here talking about patient preferences and values,
Sure.
but it can get shot down by the insurance that says that is the only one.
Absolutely.
And
Yeah.
then you're like, well, what can we do?
Right.
So then you have the gels, which are again popular. So gels are typically applied over the upper arm and shoulders. That's called androgel. It's a very popular gel. Then you have a different type of gel that's applied in the armpit, and then a different kind that's applied in the thigh. So different areas. The two things to know about that is it's a daily application regimen.
see.
You have to put it on every day. And I recommend guys to do it after they shower in the morning. That's when the pores in your skin are open.
You should have like a
It's sucked in.
prescription testosterone deodorant. See?
Yeah, no,
Don't be
good. Has
laughing.
been thought of.
Yeah. I'm not laughing. I'm just-
But
it's actually a good idea.
Yeah, but what happens is the deodorant section of that can delay the absorption of the testosterone.
Okay.
So which is why men that choose to get the armpit
Yeah.
form of the testosterone they end up applying a light layer of the deodorant first and then the testosterone, because you don't want to contaminate your
Right,
deodorant. So they
right.
do that. But again, I've seen issues with some of that
Yeah,
too.
yeah.
And although they claim that axillary armpit hair doesn't impair, sometimes it can do that too.
Right,
So
right.
it's a little bit of a gamble with skin-related products. And again, you get into this thing which you can never tell beforehand, where men just won't absorb it well enough. We don't know why.
Right.
They will do their diligence and do that. And again, with men, when you give them something to do every day, there is a problem, right? We'll admit. I'll admit.
That's true. Yeah.
So,
Good point.
compliance is an issue there.
Yeah.
You know, they may forget, they may,
Right,
and
right.
then, and it's such a short-lived drug. It only is in your
Yeah.
system for 24 hours. So if you go 2 days without doing it, or if you forget to take that in your bag while you're on vacation, that's not going to be a pretty one. So I have a lot
Yeah.
of guys telling me that.
It's
Oh
too
my
bad we
gosh.
just can't have an oral replacement that works.
There is. Your question's answered.
There
Now?
you go.
Yes.
Because there hasn't been up until recently.
Yeah, so I was going to get to that, but because you talked about it, I'm excited about this product. So it's
This
called.
must be brand new.
It is relatively new. Yes, so
Mm.
it's been in the market for about year and a half to 2
Okay.
or so. Yeah, so it's called Jetenzo. So it's the first FDA-approved testosterone capsule. It's a capsule. So why we took so long to have a oral pill
I know.
developed is because in earlier studies, all oral androgens or testosterons were not liver friendly. So they caused a lot of liver issues, liver enzyme elevations, and rare cases of liver cancer too. So when they saw those associations, it was completely, not even worth exploring. And this drug though has been, I know of a few other companies too that are trying to develop a testosterone drug, but this was the first to get FDA approved. So this was cleverly designed where the capsule is absorbed into the lymphatic system, it bypasses the liver, and it gets into your blood. So very smartly engineered drug.
Yeah. Is this being covered by insurance companies?
Yes, for now, yes, they do have some promotional programs where you have copay assistance and all of the bells and whistles that any new product generally has in the market.
That's interesting. I haven't seen it advertised.
Yeah, so I'm not sure about why it's not. I haven't
Yeah.
seen any TV ads for it
Because
either.
this is really a huge product.
It is.
I'm surprised.
It is, yeah, but again, the patient, like I said, patient preference dominates. Sometimes I've been so excited, but my excitement has been met with zero excitement by patients who are
Right.
sitting in front of me. Like, I don't care.
Yeah.
I'm like, oh, really?
Yeah.
So you
Not
have to
so
take
much.
it twice a day again,
Yeah.
giving a
Okay.
guy something to
Oh,
take
that's not
twice
gonna
a day.
work. That's not.
See? Yeah.
Yeah.
So and you
Twice
have
a
to
It's a little
day.
challenge.
I know, and you have to
No.
take it with food because it
Wow.
relies on fat
Okay.
in your diet to get absorbed into the lymphatic system.
Yeah.
So you have to take it twice a day with food. But I've seen some very good results. with it.
Really? That's great to
I
know.
have
So
very-
many options.
Yeah, you have a lot of options, and again, you have to always also keep in mind how the body deals with those drugs. Or in other words, what are your levels doing, right? With an injectable, we just covered the roller coaster.
Right.
With gels, if you're applying it like a good boy, you will have good levels every day.
Yeah.
Nice, even levels, which
Yeah.
will make you feel, desirable and to be around with on a daily basis. The pill does the capsule does the same. It's doing a very nice, smooth level sort of
Nice.
profile, which is
great.
nice. Talking about skin products, one of the products that really didn't launch much was a nasal gel. It was called Netesto, where you put it inside your nose. And they developed that product keeping in mind that some of the other skin products do have a risk of transferring to your partners or your children. And children and women are very sensitive to even a little bit of testosterone rubbing off on them.
Right. Right.
And there have been reports of kids going through puberty precociously or
Okay.
partners growing hair and beards.
Yeah,
and,
that's not gonna work.
Yeah.
Yeah, exactly. So that's why they developed the nasal product. But again, you had to apply it 3 times a day and all of that.
That's
So
tough. That's
that
Yeah, it's
didn't,
too challenging.
went out of favor. So the capsule has been, one of the newer therapies that has been
That's
around.
great to know about.
That's I have quite a few patients on it that are coming back to me with good results.
Good.
and things
Excellent.
like that.
So I
yes.
think we're pretty much out of time.
I think
This
so.
it's a full hour.
We could have
It
talked
flew.
hours
I
on
could
this.
talk like another hour, but
would be
we'll
nice, yeah.
yes, we need a repeat
I
performance.
never knew you were so interested in men's health, Nancy.
Of course I am. I love my husband. I'm going to stay right on top of things.
There you go.
Good. Well, thank you very much. This has been
course.
fabulous. Is there anything you want to just say to wrap things up? Any message you want to get out there?
Yeah, no, definitely. So I think when it comes to your sexual health, definitely discuss with your physician about it, because it could be like a little warning sign of something else that might be brewing in the background for you. And I think it's important to talk about it with your physician, get treated or tested for it, and then get treated appropriately. And I would say, I would also tell guys that, sort of have related symptoms to sort of respond to things that are heavily advertised, testosterone clinics and ads and virtual things and all of that, with a little bit of caution, because if there's not a health professional that is involved, that looks at things holistically, not just from a number standpoint, you
Very
may not
important.
be in good hands. So I definitely want to add that little piece of caution.
Nice.
That's great. I love the approach you have, where it's really more.
I know. I
you
love
know,
that approach
yeah,
too.
it really is.
It's really cool.
So great. Well,
Yeah.
thank you so much. I want to thank, of course, our sponsor, Bay Coast Bank. Right, for all of your financial needs, visit baycoastbank.com or call 508-678-7641 to learn more. And of course, I want to thank Dr. Lakshman for this incredible discussion about men's health. I think everyone learned a lot. I learned a lot too.
Yeah.
And I deal with this in my practice, but I
Yes.
learned a few things.
There you go.
So that's great.
Wonderful.
Thank you very much. And,
My complete pleasure.
and we will have you back for another topic of interest
Sure.
in the near future.
Happy to.
So I don't know if you want to mention that as a teaser now, or just should we mention what the topic will be? You can talk about your other interests just quickly. Say
Yeah,
what
sure thing. Yeah, so what I also have that I'm passionate about is a transgender clinic in Prima Care, which really is welcoming to patients, people that have gender dysphoria and are looking to start transitioning, looking for support, looking really for a physician and a friend to hold their hands through the journey. We offer those services as well. In addition to men's health.
Yeah, it's
So-
a great asset to the community. It's great that you're
Absolutely.
doing that. So we'll have that discussion probably over the next few months or so. We'll have you back.
Absolutely. Be my pleasure
right.
to come back. Yes.
All right, very good. Well,
Thank you so much,
Thank you,
Doctor.
thank you so much, and
You're
thank you
welcome.
everyone for watching the 27 Degree with Chris and Nancy
Thank
from
you.
27 Degrees Consulting. Take care and have a great weekend. The weather looks good out there.
Take care.
Bye now.